What should you do when you see somebody having a seizure? If it is a brief focal unaware seizure or an absent seizure, just make the person sit down, and most of the seizures would settle down by a minute or so. If the patient has a convulsive seizure where there's a lot of movement, make the patient lie down, preferably to one side. Don't put the patient fully onto the side so that the shoulder shouldn't get dislocated. Just tilt the patient to one side with the head turned to a side so that the saliva or if there's anything else in the mouth doesn't get into the lung. And there's no point in giving a key or a metal or making the person smell a shoe, because none of this actually works. After that, the patient regains consciousness after a variable amount of time depending on how severe the brain is suppressed after a seizure. If a patient doesn't stop seizing in 2 to 3 minutes, then that means there's a risk of seizures going on for a long time. Any seizure lasting more than 5 minutes is a risk for status epilepticus, and that needs hospitalization. So shift the patient to the nearest hospital, and he will require intravenous or intramuscular injections to stop the seizure.